Hi, my name's Sam Clark from the Movement Studio and the Spinal Recovery Program, and in this short video today I'm going to talk to you about a fairly unnerving subject, and it's this: what if our painkillers that we take can sometimes have the potential to make our pain worse? Now, if you're anything like me, then you'll understand the freakishly profound sense of disability that back pain can cause you. And during the darkest days of my own chronic pain, which was pretty brutal for around 2.5 years, right up until I committed fully to making the adjustments in my life to change that, you know, I found a lot of things really challenging. I found it painfully difficult to stand up straight from a chair, for example. You know, I was turning up to work, and that was a challenge as well, to be honest. And in bed, I was lying in bed and I was looking at my phone, and I was kind of just sitting there scrolling through all the research articles that I could find. And I was just there hoping that, you know, the next day I'd wake up and my pain would somehow be magically gone. And it never was. So, you know, how the hell do we change something that we can't even see, and something that, you know, seemingly comes out of nowhere and causes massive disruption to our life? And that was kind of the question that I kept asking myself when I was struggling with my own chronic pain. And I remember working with a person at work who had the almost identical symptoms to me, and they'd been that way for about a year. And, you know, they were initially prescribed painkillers, and in this case they were on codeine, they were on tramadol, and they were on naproxen. But after about 6 weeks of use, the benefit of some of these drugs was gone, and if anything, their pain was getting worse. And it was around this time that I was beginning to spend a lot of time in professional development seminars, and I'd recently been to one on chronic pain and opioids, and it was run by a pain doctor. And I found out some interesting things that really made sense to my own problems and to the problems of that patient. I found that their tramadol and their codeine in fact had the potential to make their pain worse when they were used long term. And this process is called opioid-induced hyperalgesia. Now, opioid is the type of drugs that they were taking. Induced is obvious, it's induced by the opioids. And hyperalgesia, well, hyper means really high, and algesia is Latin for pain. So hyperalgesia, high pain. And in basic terms, with continual use of these types of drugs, we often see changes in the function of the nervous system, particularly the central nervous system, which consists of the spinal cord and the brain. And these changes increase our potential to experience pain, and it makes our body a lot more sensitive. Now, it's quite paradoxical really that taking painkillers after a certain point can have a tendency to actually increase our pain levels. So let's just put aside for a moment the whole stigma against opioid use, you know, due to its addictive and its narcotic effects. And let's just focus on this. For me, it doesn't really make sense to continue using a painkiller on a practical or even a clinical level once we build a tolerance to it, especially if this particular painkiller has, you know, the potential to flip the benefits on its head so that we actually end up experiencing more pain than we were in the first place. And it can make the pain we're trying to help actually increase. And I know from my own experience of chronic pain that, you know, the suffering it can cause when it gets out of control is tremendous, and it can be life-changing. But the problem is that when we take short-term fixes, when we take painkillers, particularly opioids, and we rely on those for a long time, our decisions that we make in the short term really begin to affect our long-term recovery. And you know, long-term chronic pain can often make our brain do some weird things. It influences the part of our brain that is related to decision-making processes, and we start making decisions that are much more emotional and much less intellect-driven. And I really needed to find a way around this if I wanted to get good results for my patients, but also for my own pain. And this is where I began to view painkillers as something that can create an amazing window of opportunity. And I began to understand on a much deeper level that relying on just pills or steroid injections or on surgery was really a big mistake, because none of these solutions actually created any real growth and adaptation in the body and in the mind of the people who were struggling with long-term pain. And they were quick fix solutions really, which gave temporary relief that I now call windows of opportunity. And if I wanted to get better at my job and I wanted to help people so that they could actually stand for more than 10 minutes without back pain and get them feeling strong and get their bodies feeling good and mobile again and get them trusting their backs to carry them through life and restore their quality of life, then I needed to find a way to use these windows of opportunity in the correct way so that they were utilized to aid recovery and not thought of as the main core solutions to recovery. Now, pain solutions that fall into the window of opportunity box will 99% of the time have the potential to give you mid to short-term improvement. But that window won't stay open forever. And I began to get much better outcomes from my people when we simultaneously focused on the real life things that were actually going to give people the recovery that they needed on a long-term functional basis. And you know, if we just relied on pills and injections and surgery, then we would typically get more ups and downs and recovery would be loads more turbulent. And now as part of the online recovery program, the spinal recovery program that we use with people who have long-term back pain, we tend to utilize something called the 3 M's to help people grow out of their back pain. And these 3 M's are movement, mindfulness, and meditation. And by strategically molding these things to patients' lives, we see it gives people back their power over their bodies and over their pain. And they have a clear plan of attack and a set of things that they can systematically focus on and apply to their lives during the other 167 hours that they aren't seeing healthcare professionals in clinics and in hospitals, and they aren't getting drugs and injections and surgeries. And you can, and in my professional and personal opinion, should consider using these windows of opportunity alongside your main recovery so that you can maximize your results. And the 3 M's need to be customized to your own individual back pain, and a cookie cutter approach, isn't going to work either. These 3 M's are what we consider the majors in back pain recovery. And then the drugs and the injections and the surgery and other procedures can be thought of as the minors when it comes to real predictable long-term recovery and empowerment of people who are struggling with these problems. So anyway, I hope that information's been useful to you, and for now, keep on moving. Again, my name is Samuel Clark from the Movement Studio and the Spinal Recovery Program, and enjoy the rest of your day. Wait, don't go just yet. If you found that content useful, then join our brand new Facebook group, Low Back Pain Recovery, and feel free to add me personally on Facebook as well. Again, my name's Samuel Clark, and in the picture, I'll be wearing this t-shirt. And of course, don't forget to like and subscribe to this channel, the Movement Studio programs. That's all for me. Again, my name's Samuel Clark from the Movement Studio and the Spinal Recovery Program, and enjoy the rest of your day.